Assalamu alaikum. I am Dr. Nafisa Rashid, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Our today's topic is lecture on anti-TB drug. Now, what is tuberculosis? Tuberculosis is a chronic granulomatous disease. You have to remember that it is a chronic disease. It is a chronic granulomatous disease. How does it cause? It is caused by an organism, and the name of the organism is Mycobacterium tuberculosis. It is commonly asked by the examiners that what is the name of the organism of tuberculosis. It is the Mycobacterium tuberculosis. And what type of organism it is? It is acid-fast bacilli. It is acid-fast bacilli. Okay. Then what are the stages of the mycobacterial tuberculosis? It has 4 stages. That means rapidly proliferating. It means that some mycobacterium causes proliferates very rapidly and some proliferates slowly. These are slowly proliferating. Some proliferates occasionally. These are occasionally proliferating, and some remains dormant. And the main problem we face mainly on the dormant bacilli. So, Mycobacterium tuberculosis stages are 4 stages. Number 1 rapidly proliferating, number 2 slowly proliferating, number 3 occasionally proliferating, and number 4 are dormant bacilli. Now, what are the drugs that we use for treatment of the tuberculosis? It can be classified into 2 types. Number 1 first line drug, and number 2 second line drug. It is very much a common question in your examination, professional examination, also in the item, also in the card final term examination. First line drugs are, you will utter these drugs serially. At first you will say isoniazid, then rifampicin, then pyrazinamide, then ethambutol, and lastly streptomycin. Streptomycin, you have already read about this drug. It is a antibiotic, and it should be given parenterally. It is not given orally. So, it is not included in the dose therapy or 6-month regime, as it is given by parenteral regime. And the other drugs, isoniazid, rifampicin, pyrazinamide, ethambutol, these drugs can be given orally. And among these 5 drugs, ethambutol is tuberostatic and other drugs are tuberocidal. You know what is static and what is cidal. I will again remembering you that the drugs which acts by inhibiting the growth and multiplication are static drug, that may be bacteriostatic or tuberostatic, and the drugs which acts by killing the microorganism are known as the cidal, that may be bactericidal or tuberocidal. So, among these 5 drugs, 4 drugs are bactericidal and ethambutol is tuberostatic, and other drugs are tuberocidal. Now, next slide, what are the second line drugs? The second line drugs are amikacin, amino salicylic acid, capreomycin, cycloserine, ethionamide, etc. You know that these types of drugs are second line. Why these are second line? Because they are not randomly used in first case. They are used when the first line drugs becomes tolerant or resistant, or they are not functioning. These types of drugs are reserve drugs. They are used only when first line drugs are not functioning. Then what are the difference between first line drug and second line drug? First line drugs are initial drug. Initial drug means when a patient becomes TB positive, at first he or she will be treated by this first line drug, that is isoniazid, rifampicin. These are the must drug or initial drug, and then if they are not functioning, then you will use the second line drug. And first line drugs are more effective than the second line drug. These are less effective, and first line drugs have less severe toxic effect. Here toxic effect is very important because the TB drug our TB drugs are used for long time, like 6 months or 9 months or 12 months. So toxic effect should you have to memorize, because the patient will suffer from different types of toxic effects. So in this chapter you will give emphasize on the toxic effects produced by this type of drug, because they will be used for the long time. So first line drugs have less severe toxic effect, so these are better, and second line drugs have more toxic effect. First line drugs have high therapeutic index and second line drugs have low therapeutic index. You know what is therapeutic index? It is the ratio between the median toxic dose and median effective dose. So if it is high toxic therapeutic index, the first line drugs will be safer than the second line drug, and second line drug will be more toxic, more adverse effects and less safer. Besides, first line drugs are less expensive than the second line drug. It is very important, because our patients, some patients are so poor that they will not buy, they can't buy the expensive drug. They will seek where the low cost drugs are available. So you also have to memorize that this type of first line drugs are less expensive and more convenient. It is easily available, and our government has taken some DOTS therapy to ensure the anti-TB drug to the common people of Bangladesh. Now I will discuss about the isoniazid. Isoniazid, you will shortly you can write INH. Isoniazid acid hydrolazine. This is the abbreviation of isoniazid, or thus you can be write in INH. What are the criteria of isoniazid? It is a synthetic drug, it is not natural, it is a synthetic drug, and it is highly efficacious drug. It is the, I have already mentioned that you will say this drug serially. At first you will utter isoniazid drug, because it is the most efficacious drug. Without this drug, other drugs cannot work in case of TB patient. Why? Because of its mechanism. It is a highly efficacious drug, and it is there is also benefit that it is very selective drug against the Mycobacterium. It can be given orally, and it is well absorbed drug. In GI tract, it is well absorbed drug, and it is its distribution is intensive or extensive distribution, and it cross the blood-brain barrier. Now, why it is more efficacious? Because it acts by inhibiting the mycolic acid synthesis. I will show you in the next slide that why how does it act, but now I am telling you that it is very efficacious than other drug, because it will break the mycolic acid of the Mycobacterium tuberculosis. As a result, it will break down the cell wall, and other drugs will enter easily into the Mycobacterium tuberculosis. Next point is it acts against rapidly multiplying intracellular and extracellular organism. You have to know it well, because intracellular organism, extracellular organism, and also rapidly growing organism. Because you will find that some drugs work against the dormant bacilli, but this type of drug doesn't work against dormant, it acts on rapidly multiplying drugs. It is tuberocidal, that means it acts by killing the Mycobacterium tuberculosis, and it is enzyme inhibitor. It is an important stem, because in MCQ these types of stem comes in your examination, that it is enzyme inhibitor or enzyme inducer. I want to let you know that isoniazid is an enzyme inhibitor, otherwise rifampicin is an enzyme inducer. You will be asked in the professional examination that say name one anti-TB drug that is enzyme inducer and one anti-TB drug that is enzyme inhibitor. Then what is the mechanism of isoniazid? In case of Mycobacterium tuberculosis, the integral component of the cell wall is mycolic acid. This is the main part of the Mycobacterium tuberculosis organism. The mycolic acid synthetase enzyme helps in the synthesis of mycolic acid, and this drug isoniazid block this enzyme. Which enzyme? mycolic acid synthetase enzyme. So, no synthesis of the mycolic acid, as a result no cell wall synthesis, or cell wall becomes defective, or cell wall becomes breakdown. And then how does it metabolize? It is metabolized in the liver by acetylation process. It is important, acetylation process, because you will see that some of us, the people of the world, some are rapid acetylator and some are slow acetylator, and you have to memorize that in Bangladeshis and Southeast Asian countries peoples are slow acetylator, otherwise the Japanese or Korean, they are rapid acetylator. And because of slow acetylator, we have to know that peripheral neuropathy is our common problem. Then what are the toxic effects or common adverse effects? Number 1, hepatitis. The patients who are rapid acetylator, they suffer from the hepatitis, and who are slow acetylator, they suffer from peripheral neuropathy. That is due to vitamin B6 deficiency. So, to avoid this toxic effect, we have to give them pyridoxine tablet containing vitamin B6. Then CNS disturbance may occur. What are they? Convulsion, seizure, memory loss, insomnia, etc. And GIT upset is also common. Then rifampicin. Rifampicin is second drug. This is a broad spectrum antibiotic. Broad spectrum antibiotic. It is also bactericidal, and the source is actinomycetes. Active against gram positive, gram negative, Legionella, meningococcus, but it acts against the bacteria, but it should be kept for TB specially, because TB is a endemic disease in our TB is a very serious types of problem in our country. So, some drugs should be kept reserved for the treatment of TB. It acts against the slowly multiplying bacteria. You have already known that isoniazid acts on rapidly multiplying, and here you found that they acts on slowly multiplying. Then what are the mechanism of action? I will discuss the mechanism of action in the next class. So, thank you. Assalamu alaikum.